Uh-oh. There we go. I think I'm live now. I hope so. It gave me a funny little message there. I am so sorry. I hate being discombobulated, so I'm just going to look on my phone to see if I'm actually live this morning. Good morning, good morning. It is 8 o'clock on July the 31st. Can you believe it's almost August? I cannot believe it's almost August. It is so amazing to me how quickly this year has gone by. Oh my word. I don't know if you guys are experiencing that or not, but yeah, this year has gone really, really quickly. Today is July 31st, and it is 8 o'clock on Saturday morning. It is super, super hot here in South Carolina. I don't know where you guys are living, but I am so pleased that you are here. This is the Baffled Brain, Demystifying Dementia, where I do a 1-hour program every Saturday morning to answer questions regarding dementia. And I have a bunch today that I thought were pretty interesting that I don't think I've always answered yet. So let's see how it goes this morning. If you're live, you can comment live. If you're on the replay, you can comment replay. I'm happy to have you here. The goal of this program is to give people reliable and accessible information to dementia-related questions. So thank you for being here. If you ask a question in the live comments, I will answer them as I'm going through questions. I have a few questions that I try to have handy so that I don't just sit here and look like an idiot. So if you have any particular question, please throw it in the comments. I'd love to hear from you. Also, if you're not a part of my group, please join my group called Think Different Dementia Education Group. I would love to have you there. I do a second video every week on a topic, just an educational topic. My name is Lizette Klute. I am an occupational therapist, and I love what I do, and dementia is my specialty. So here's the program for today. Welcome. Glad to have you here. Let's see. So the first question I thought was really interesting. This one is Judy, from Miss Judy. Miss Judy, I will tag you in this later on. She says, my older sister passed away at the age of 70 from early onset dementia. It started about 6 years before her death. She was an active person, then had a foot injury and became most inactive, gained weight, and didn't have a very healthy diet. At the very end, she was very skinny, very thin, looked like she had aged 20 years and was nonverbal. And her question was, could her inactivity and her poor diet have contributed to her dementia, and is dementia hereditary? And then Judy said, my dad lived to be 98 and was healthy. My mom lived to be 86 and in the end had hydrocephalus. And so, yes, Judy, that is a very good question. So I'm going to break it down into a couple of pieces, right? So, is dementia hereditary? Yes, certain types of dementia can be hereditary. Frontotemporal dementia can be hereditary. Alzheimer's dementia has a hereditary component. People can carry a gene for dementia, but just like a normal risk factor, certain risk factors you can mitigate and certain risk factors you cannot mitigate, right? You can change certain risk factors, you cannot change other risk factors. But just because somebody has a gene for dementia doesn't mean that they're going to get it. It just means they're more at risk to get it, Miss Judy. So you said a couple of really interesting things in your question. You mentioned that your dad lived to be 98, and you mentioned that your mom was 86 and had hydrocephalus. Well, there is normal pressure hydrocephalus is sometimes grouped under dementia. And remember, we talk about dementia all the time as being the term dementia is a umbrella term, right? And so the term dementia just means, the words dementia just means out of one's mind. And so there are different types of dementia, Judy, and normal pressure hydrocephalus can be considered one of them. So what your question was about your older sister being 70 and had early onset dementia, and she'd gained weight and was very unhealthy, had an unhealthy diet at the end, could her inactivity have contributed to her dementia and her poor diet? So the answer to that question, Judy, is yes. It could have contributed to the dementia, but it might not have necessarily contributed to the end stages of the dementia. So frequently what happens is, I think what we forget is that even when people are diagnosed with early onset dementia, right? When somebody's diagnosed with dementia, say I'm 60, I'm not, but say I was 60 years old and I was diagnosed now at 60 with early onset dementia, the changes could have been occurring 10 years ahead of that. So your sister might have been diagnosed in her early 60s, but she might have been having those changes 10 to 20 years before any of the signs or symptoms truly came out. And oftentimes when you start to talk to people about tracing back when a person's changes actually started to occur, frequently the first sign that we start to look for, that we, family and so on, start to take somebody in, is because they're having trouble remembering something in their short-term memories, right? Or their short-term memory. But if you backtrack it, oftentimes the first sign of dementia, if you go back a few years, is a change in a person's personality. So there are lots of different things that come out in your question here. And I hope that was a good answer to your question, Judy. I will tag you in this, and hopefully you'll be able to watch this a little bit later. For anybody out there, I would love to have questions from you guys who are on live. That's why I'm here, is to answer your questions specifically. I love answering questions from people who are watching this video or this program, because that's my gift to you. If you don't know me, my name is Lizette Kluta. I'm actually an occupational therapist, and I still work in home health, and I have another little group called Think Different Dementia Education Group, where I do another program once a week on a topic related to dementia. We're kind of working through lots of different topics. So I'd love for you to join the group. Like I said, it's called Think Different Dementia Education Group, and I will put a link in the comments later on for anybody to join. You're welcome to join. So since I don't have another question popping up yet this morning, I am going to answer another one over here. Now this one's going to be about humor. So I haven't actually spoken about this one before, or I've not noticed a lot of people actually ask questions about this, so I thought this was a really good question this morning. And the person who asked this, her name is Sandra. So here we go. My mom is in early to middle stages of what she is guessing to be her dementia journey. She said, is it normal for people with dementia to completely lose their sense of humor? And so here's setting the stage, right? We used to be able to joke around with my mom, but most times lately you try to say something funny and she gets super pissed off. She starts yelling and screaming at us. She says that her uncle and her, she says that those things that we are saying aren't funny. We ask her why. She says it's because I don't understand it. So we explain the humor to her. She starts yelling and screaming at us because she still doesn't find it funny. And then Sandra said, I made the mistake of saying we're not allowed to joke around anymore. And she says, of course you can, as long as it's funny, right? And so, and then Sandra said, as long as you find it funny. And then it was a very hard situation for her in being able to deal with her mom and her humor. And so this was a really good question, Sandra. I know there's a lot going on here. Further on in your description, you talk about a lot of difficulty communicating with your mom. So let's break it down a little bit first. So what is humor? Humor is actually a pretty high level cognitive skill, right? So if we just think about using, I frequently use the functional assessment staging tool, right? We talk about that being a retrogenesis model, which means going back to the beginning, and that people go through certain stages. According to the retrogenesis model, there's 7 stages with some sub-stages to it, right? 1 is normal, and 7 is somebody who is at end-stage dementia. Well, each one of those kind of correlate with chronological ages. So if you think about people developing, most people have been around, children developing through normal developmental ages. At a certain age, a kid just does not get things that we do. They don't see the humor of it. A very good example of this would be watch some of the Disney movies that are made for kids as an adult. Watch them because they have humor for the kids that are more concrete, very easy to understand. And then they have bits of humor in these movies for the poor parents who have to take the kids to the movies, right? So humor is actually a very high cognitive skill. It's an abstract concept. It's not something that is easily explained, but it falls under the executive functions. It falls under those higher level skills that a person has in their ability to understand things. And so, Sandra, you mentioned a couple of things. You mentioned that you joke with your mom and you ask, is it normal for them to lose their sense of humor? I think it is very, it's a part of the progression. So I've also had to change how I try to joke with my mom because she doesn't get a lot of the jokes that we're making, especially if they're abstract, especially if they are a play on words and those kinds of things. And then you also mentioned, Sandra, that you try to explain it to her. You try to explain why it was funny to you, but then you're trying to rationalize with your mom. And rationalizing with somebody with dementia is really not an effective strategy of communicating with them. It's very difficult for people with dementia to be rationalized with. You understand what you're saying to your mom about what you described as being funny, but your mom doesn't get it. So trying to explain it to her is just going to continue to increase her frustration. And so I know, based on your question, you have a lot going on. And bottom line is, when we try to communicate with a loved one, they're usually, so your mom's behavior, you described a lot of behavior of her yelling at you. You've described your interaction with her as being a little bit difficult for you. So there are 3 things that are always working together in order for us to have good communication with somebody with dementia. And those 3 things are the person with dementia, the care provider, care partner, care companion, which would be you, Sandra, and then the environment, right? So those 3 things. And as long as those 3 things are in a good balance, there's a happy spot. When one of those 3 things is out of balance, whether it's the person with dementia being frustrated, her behavior of yelling at you after you've tried to make a joke with her, is her trying to tell you something. She's frustrated. She's trying to tell you something, but she's not able to tell you it anymore. And so I ask you to consider whether your interaction with her is actually triggering her yelling at you. And so try to reframe things with your mom. I know it's frustrating, but if you're the one that can adapt, your mom cannot adapt anymore. So the only way to truly improve your communication with your mom in these type of situations is for you to change. Your mom's not going to change. Rationalizing with her and trying to explain to her why you think something is humorous is only going to make the situation worse. So I would encourage you to consider joining my group called Think Different Dementia Education Group, where we kind of talk a little bit more about strategies on how to help communicate better with someone with dementia. So I thought this was a great question, though. I've not answered any questions on humor before, so thank you so much, Sandra, for your question. It was a very good question, and I am so glad you tuned in. Do you have a particular question for me this morning? I would love to answer a question for you specifically. How are things going in your neck of the woods? I know that you are in, I can't remember if it's Kenya or I think it's Kenya or Uganda. It's one of the two. Please ask me a question. How's your loved one that you're taking care of? I am super glad to have you here. Thank you for joining me this morning. So the next question came from Erica. Alrighty, so Miss Erica, I need advice. I also think this is a great question, but I think all questions are good. Somebody once said that people have told me there are no stupid questions. Kenya, I sort of kind of remembered. I still want to get to Kenya. That's on my bucket list. And when I come to Kenya, I'm coming to visit you, Miss Anne. So, all right, so let me, what was I going to say? Oh, people say there are no stupid questions, and I actually disagree with them. There are a few stupid questions. Here are a couple of here's one really stupid question that I have gotten frequently living in the United States. So here is my little story for the morning about a stupid question. So I am from South Africa originally. If you guys cannot tell, I do have a little bit of an accent. But in any case, so somebody once asked me, do you celebrate 4th of July in South Africa? And I just sat there and I looked at them and I'm like, what is 4th of July? And they're like, Independence Day. I'm like, whose independence? I live in the United States, right? And they're like, the United States. I'm like, why would we celebrate 4th of July in South Africa? It's not our Independence Day. So yes, there are some stupid questions, but this one was not a stupid question. I think this is a great question. So here is the question. All right, I need some advice. I'm one of 3 children. The other kids seem to keep their distance. My loved one has Lewy Body Dementia, heart failure, COPD, which is chronic obstructive pulmonary disease, rheumatoid arthritis, and is on oxygen 24 hours a day, 7 days a week. And now is dealing with depression. Okay? He just had a CT scan, and there's also showing that there is a mass in his lungs that is growing. We have not told him yet. Should I tell him? He will not remember it, if he does, it will get him more depressed. He signed a DNR and wants no life-saving measures other than his oxygen. If we put him through the treatment, he will be in pain and depressed. Do we just let him enjoy the rest of his life and make him comfortable? It's all up to me, Erica. I'm his power of attorney, his healthcare power of attorney, and he is my best friend, and I need some advice. So there's a lot going on in this question. Erica, first of all, I am so sorry that your dad, I think it's your dad, that he's going through this. and that you're having to deal with this on your own, and that you don't have the support of your siblings. That's a whole separate conversation. But we're going to talk about your bigger question about your loved one with Lewy Body Dementia, lots of medical issues, heart failure, chronic obstructive pulmonary disease, rheumatoid arthritis, already on oxygen, and now having a CT scan showing a mass in his lungs, right? So that is super packed, super packed with so much stuff, and depression. You mentioned that he has already signed a DNR, and that you're frustrated that your siblings aren't helping, and you feel like the burden is on you to make the decision. So the first thing I want to say is that your loved one, when they appointed you as the power of attorney for healthcare decisions, knew that you would have their best interest at heart. If you know your loved one, if you have spoken to your loved one previously, and that's one of the first things that I beg people to do when they first find out a loved one has dementia, is to start to have these end-of-life conversations with them. If you, Erica, have had these conversations in the past with your loved one, with all of this medical stuff going on, you know what to do. It doesn't make it easy, but you do know what to do. It sounds like, based on your description, that he has multiple medical things going on. And so I would not, one of the questions you asked, Erica, is if you would tell them. If he's not going to remember, and it's going to frustrate him, or he's going to have, go into a spiral because you tell him, or you have to repetitively tell him, then I might not tell him. But you are the only one that can decide that. We don't know your dad or your mom or your loved one, right? You are the person who knows your loved one the best. So you have to make the decision, first of all, whether or not to tell him. I could tell you that I probably wouldn't, because it would just perhaps make things worse. Or you could try telling them once and seeing how they respond. But if they don't ask again and they don't remember, I might not tell them. Maybe to have a clear conscience on myself that I've, played open cards. But if it upsets him to find out that he now has these other healthcare concerns occurring, I might not tell him. As to your statement, do we just let him enjoy the rest of his life and make him comfortable? Absolutely. So there are two levels of care. I assume that you're in the United States. I could be wrong. But here in the United States, there are two things at the end of life that I would, based on his diagnoses, beg you to start to consider. The first one is palliative care. So palliative care is a step in between. I don't want to say a step in between, but it's a system in the United States that we use to be able to manage symptoms, right? So when we first are diagnosed with these kinds of things like heart failure, COPD, a lot of chronic medical stuff, we can manage them medically, right? So we manage them medically, and we're trying to improve. Well, there comes a point, especially with heart failure, dementia, and COPD, those three chronic conditions, that we get to a point, Erica, that we are not able to manage and improve them, and it turns into what we call symptom management only, and keeping people comfortable. And that is where palliative care is helpful. Another thing palliative care can do in the United States, it just depends on where you live. But if it's really difficult to get your loved one who's on oxygen, has dementia, Lewy Body Dementia, heart failure, COPD, all of this stuff going on, and rheumatoid arthritis, if it's really difficult to get him out of the house, palliative care, at least here where I live in South Carolina, if you pick the right agency, they will send a nurse practitioner to the house. And so that nurse practitioner starts to manage the symptoms. And we're working on trying to prevent things from getting worse, but we're not trying to make a person better anymore. We get to a point where we cannot make a person better anymore. And we're working on managing the symptoms, so as they're progressing or declining through all these medical things, that we just manage and keep them comfortable. Now, when it comes to a point where the palliative care is not sufficient anymore, then they can help transition a person over to hospice. And so the purpose of hospice is to keep somebody comfortable. And people are so afraid of hospice. I don't want you to be afraid of hospice. Hospice is a great service. And hospice is something in the United States that is paid for. And it gives you additional resources and additional help in the home, which at the end of life is so vastly needed, and people wait too late. And I know it's scary to think that somebody you love is going to pass away. But we are all going to pass away. None of us, none of us are going to make it out of here alive. And so some of us, fortunately or unfortunately, I don't know which way you would see it, some of us know that we're closer to the end of our life. And based on your description, your dad is, or your loved one, is closer to the end of his life, their life. So we can't change that, but what we can do is manage it to the best of our abilities, which means being able to keep somebody comfortable. And as hard as it is, Erica, and I'm so grateful that you're here, but as difficult as this is, and as hard as it is to be in that situation, it is a blessing, because you can put in strategies to help. It doesn't take the hurt away. It doesn't take the pain of making these decisions away. But what a blessing you have in being able to manage this part of your loved one's life. I think it's a blessing from the Lord. I really do. You have an opportunity to say goodbye. You have an opportunity to get strategies in place. So if you need any more help with this, Erica, please reach out to me. I would love for you guys to join my group called Think Different Dementia Education Group. I'm super grateful that you were here this morning. I see a couple people on. If you have a particular question that I can answer for you today, that is what I'm actually here for. I'm actually here to answer your questions. So if you have a question, please throw it out in the comments and I will answer them. But Erica, thank you for your question. It was a hard one, but we shouldn't be afraid of having these conversations. I know they're hard conversations to have, but reach out if you have any more questions. All right, so this is the next question. This is one that's coming up more and more lately. So I unfortunately didn't write down who actually asked this question, but I think this is a good question. Is anybody else having issues with their marriage when one of you is dealing with their elderly dementia parent? My husband said he could not handle my mom living with us, so I moved into an apartment with her and come home 2 weekends a month. This has put a strain on my marriage, but what choice do I have? So I have to answer this question out of my worldview. Everybody has a worldview. Everybody comes from a certain perspective. And I'm a pastor's wife, and I am a Christian. So I have to answer this question from that perspective. And to be perfectly honest, this is something that my husband and I have to deal with too, right? So the question is, how do we manage dementia and a parent and our spouses? So that's a hard situation. Now, this particular person said that she moved in with her elderly parent to take care of them because he couldn't handle his mom living with us. So she moved into an apartment and goes home twice a month. And this is putting a strain on her marriage. So I have to answer this question from, like I said, I have to answer this question from my worldview. And this is a very hard thing for people to hear. And this is something I have to keep in the forefront of my mind every single week myself. Because once we get married, we leave and cleave. Our primary responsibility is actually to our husband and not to our parent anymore. We establish a new household. And so I am so grateful that this person wants to honor their mother and has moved in with her because her husband didn't feel like he could manage her at home. But her primary responsibility is to her husband. And if this is putting a strain on her relationship with her husband, it might be time to consider doing something differently. Obviously, if there is enough financial resources to set up a separate household, because she mentions that she's living in an apartment with her mom, if there's enough financial resources to set up a separate household, then I would, we have to try to see if you cannot provide, if there isn't other ways of providing 24-hour supervision for your mom in that apartment, and your husband doesn't feel like your mom can live with you, but your primary responsibility is your husband, then perhaps we need to consider something like placement, as hard as that is. Because just as much as when we have kids in the house, when our children are little, our primary responsibility is our spouses. So if our kids, if we pour everything into our kids and 18 to 20 something years later, our kids are out of the house, we have no relationship with our spouse, then we end up in a bad situation, right? Potentially a divorce situation or other things. The same thing with taking care of your elderly parent with dementia. If you are now so focused on taking care of them and you're not taking care of your responsibility with your husband, when your mom passes away, you might not be able to regain that covenantal relationship with your husband and then end up in a divorce situation or something like that. So I would consider these things as you make your decisions. Does anybody on live have any particular questions for me? I'd love to see you guys ask me questions. It's been a very quiet morning this morning, but that's okay. I don't mind. I'd love for you to join my Facebook group. It's called Think Different Dementia Education Group. I changed the name a few weeks ago to reflect that it is more an educational group. It is a supportive group, but it is not a support group. It is truly there for education. So the next question is the following. I feel like a total failure. My husband has dementia and no longer has any short-term memory. I get so frustrated having to repeat over and over answers to questions that are asked a dozen times a day. I get very short with him. I don't mean to, but it's driving me crazy. Anyone have any insight on how to manage this? Help. Yes, that is really difficult. There are a lot of things that you can do to manage repetitive questioning. But there are always three things that I encourage people to remember regarding a person with dementia and any challenging behavior, right? Repetitive questioning is what we call a challenging behavior. Now, what are challenging behaviors? These are anything like wandering or sundowning or exit-seeking behavior or refusing care or help. All of these challenges that we have with people with dementia are called challenging behaviors in like my world, right? And so here we are talking about somebody who is exhibiting a challenging behavior called repetitive questioning. So always when we think about a person with dementia, any type of behavior, any type of challenging behavior is their attempt to try to communicate something to you. They cannot necessarily explain anymore to you what's going on. And so challenging behaviors always have some sort of a trigger. And those triggers are the things that we want to try to figure out. And it's very hard, and that's why an occupational therapist like myself, and I'm actually specialty trained in a process called Skills to Care, which is designed to try to figure out what triggers these behaviors. And there are only there are only about 100 therapists in the United States who are certified in Skills to Care. But bottom line is there are three things that we're always going to keep in mind. It is a person's ability to try to communicate something. So when we start having repetitive questioning, it's because I'm trying to communicate something to you. And there are three things: the person with dementia, the care partner, and the environment. And when those three things are in a good alignment, then the challenging behavior doesn't occur. When those three things are out of alignment, so for example, the person with dementia, is there something going on with them? And this is for any behavior, not particular to the repetitive questioning, but any behavior. Do they have a urinary tract infection they can't tell you? Are they constipated? Are they hurting? Are they tired? Are they overstimulated? Are they understimulated? All these different things, right? Or the care partner. Are they, you mentioned you get short with him sometimes. Okay, so as a care partner, you getting short with him, is that triggering the behavior further? So it's kind of like a little bit of a spiral, right? I'm sure it is very frustrating. But the care provider, the care partner, the care companion can actually trigger the behavior to get worse. And then the third part is the environment, right? Sometimes our environment, just our home environment, can be a trigger for somebody with dementia. And you have to turn into what I call the dementia detective. You literally have to stop and start to diarize. You need to write things down. You need to write down as much detail as you can about the behavior. So your behavior is repetitive questioning. So you have to stop and say, okay, now this day it didn't happen. We didn't have as many questions on this day. What was different today? That's, who was here? What did they, were we really busy and we were engaged, we went out, we had, we did all of these other things, and so we didn't have as much repetitive questioning. What worked on the days that the questioning wasn't there versus on the days that all of the repetitive questioning is occurring? You've got to write it down. Who came to visit? How long were they there? Were we overstimulated? Were we understimulated? Diarize. The more you can write down what the behavior is and what's potentially triggering it, then you start to look for a pattern. And you look for the pattern to see if you can change something. So whether it be you, the person themselves, because they're overstimulated, or understimulated, or the environment, but you've got to figure it out. So you turn into the dementia detective. A good example of this, and I actually just did this with a patient this past couple of weeks, right? The challenging behavior that her husband had identified was that she wakes up at night. She keeps waking up at night. And so we started to explore their sleep, and their sleep, everything around sleep. Well, he is such a good partner to her. He is doing such a good job of taking care of her. They married when she was 14. I lied. They got married when she was 14. And so he truly has her best interest at heart. And so what we started to figure out was that she would be napping during the day because he would be doing things to keep the household going. And so when she would nap during the day, she didn't sleep. And then we started to talk about keeping her actively engaged in the day. And so as she is more actively engaged in the day, he would give her some tasks to do, and he would make sure she was doing her exercises that therapy had provided her, and that he would really just keep her more active instead of just passively letting her watch TV, but more actively engaging her in a daily routine, and keeping their sleep schedule very systematized. So they went to bed every day at the same time, they'd get up at the same time, and he just made those changes, and bam, all of a sudden she's sleeping through the night again. So all of this stuff, just to go back to your question about the repetitive questioning, is you have to kind of be the dementia detective and figure out what is triggering him asking these repetitive questions. And so if you want to, you can reach out to me. I'd be happy to help you. And then also, please join Think Different Dementia Education Group. We do weekly videos like this for an hour long, just on an educational topic. So I would love to see you there. Next, so nobody has any questions this morning. That's kind of unusual, actually. I need a sip of water. Only have 4 more questions on here, and if I'm don't have any more, we'll be done early today, but that's okay. So here's a question. Hi, I'm looking for any advice or insight. Oh, and this one actually is kind of close to my heart, actually, because this happened to us. We're going to talk about people with dementia being scammed, and this happens a lot. I'm looking for any advice or insight. My 66-year-old mom confessed to us that she has given at least $20,000 to her online boyfriend. And she wants to cash out her 401k to give him more. And allegedly, he is obviously going to reimburse her, right? Not, for all this. So she will obviously never get her money back. She's coming over tomorrow so that we can call the FBI together, which is the very, very first thing you've got to do. My concern is that she's gotten involved in some sort of fraud. Yes, she is being scammed. Anybody else have been through something like this? I knew it was going to happen, but I didn't think it would be this much money. She has taken out a loan, and she's living off of credit cards. I'd like to take over her finances, but I'm mostly concerned with the FBI now. I'm furious at her, but staying calm. Thanks in advance. Wow. My dad was scammed. That totally blindsided me. I am an occupational therapist. I've been an occupational therapist for almost 30 years. Did not see it coming. Not for myself, not for my dad. Did not see it coming. Yes, scams happen a lot with people with dementia. You are doing the right thing to get the FBI involved, because I think you have a little bit more of a line onto who this person might be, her online boyfriend, right? $20,000 is a lot of money. My dad was scammed out of $1,000, and it totally, that was bad enough. That was truly, truly horrendous. So I can't imagine how you must feel, and how I can certainly imagine how frustrated you must be with your dad. Your mom. I was very frustrated with my dad. But having said that, yes, the FBI first. Second of all, you need to get financial power of attorney over your dad. And if he is not willing to, I'm sorry, your mom. It's your mom, not your dad. You need to get financial power of attorney over your mom. And then you might actually, if she has not done that yet, it now is the time to get that piece in place before it becomes so evident that your mom is having so much trouble with her executive functions that you cannot get a healthcare power of attorney or a financial power of attorney in place. So after the FBI, I would get a financial power of attorney and a healthcare power of attorney in place, and then I would try to walk with her and do her finances together, at least at first. What we did with my parents is we actually set up, it's called Keeper. It's a password keeper, which means all of their stuff goes through one password place, and I have their master password, so I can get on their bank accounts now and see what's going on without, being there. And so I'm overseeing it, but I'm not like right there doing their bills yet. Getting close, but not quite yet. The fourth thing that you might have to do, and you'll have to decide maybe in conjunction with the doctor. If you've not had your mom tested, you need to have your mom tested and see if she's still competent to make these decisions. If she's not competent to make these decisions, what you would need if you're in the United States is to take, you need to get 2 physicians to certify that she's not competent to make her decisions, and then you don't have to go, especially if you have, so this opens up, a hard conversation about competency, right? There's a difference between, so the reason I tell people always get your healthcare power of attorney and your financial power of attorney in place first is because then you can go to 2 doctors and get somebody declared incompetent. 2 physicians can declare somebody incompetent in the United States. The appointments cannot be on the same day. One has to declare them incompetent one day. Another one, you can take them to the same practice, at least in South Carolina. You can take them to the same practice. They just have to see 2 different physicians and be declared incompetent to make their own decisions. And then you can enact that healthcare power of attorney or that financial power of attorney, right? The harder step is if they won't go down, if they refuse, the person with dementia refuses to put this stuff in place, then sometimes you have to go to court. If they truly cannot make their own decisions, you have to look for guardianship or conservatorship, and that is a legal process in the United States. So that's why I always tell people immediately when somebody is diagnosed with dementia, please get these pieces of paper in place. A will, a healthcare power of attorney, and a financial power of attorney, because that means that you can sometimes not have to go to the expense of getting a lawyer, having to go to court, because it is a hard process to go through court to get conservatorship or guardianship over an individual. They don't take it lightly because you're taking people's rights away. So I would strongly encourage you regarding the scam that your mom went through. Yes, go into the FBI is the first step, and then I would do these other steps in place too. Thank you for joining me today. I would love for you guys to join my group. It's called Think Different Dementia Education Group. My name is Lizette Klute. I'm an occupational therapist, and I have 3 more questions. And this is this is an interesting one too. I love talking about. I love talking. Period. But anyway, here was a question: what can I give my mom for sleep? Ambien doesn't do anything, and she's on Seroquel, and it's also not necessarily doing anything. We've tried melatonin, and she hasn't had a good night's rest for a week now, and she's very out of control, yelling and fighting. So this goes back to the question a couple of questions ago about challenging behaviors. right? Challenging behaviors always are a symptom of something else. It's the person with dementia trying to communicate something to you. So what you're seeing is sleep, but there is so much packed into this, right? Yes, medication. I am not saying do not take anybody off of medication. I'm not saying take somebody off of their medication. Please don't do that. That is not what I'm saying at all. But every medicine has a side effect, and every medication can actually have an opposite effect on certain people. You mentioned Ambien and Seroquel and melatonin. Now, the interesting thing about melatonin with people with dementia is it sometimes can make things worse. We have to be very cautious with people with melatonin, with dementia with melatonin, because melatonin is a hormone. And we sometimes give people too much melatonin, and it can, there's a lot going on with melatonin. So if you're going to give somebody with dementia melatonin, please make sure that you're doing it in conjunction with somebody like a physician or a naturopath, or somebody that knows how it's going to affect them. But there's so much more that goes into sleep, and that is, we talked about the three things that have to come together. So is her sleep a symptom of something else? Is what's going on in the day? Is you mentioned yelling and fighting, right? So you've got to turn into a dementia detective. We've got to look at mom. Is there other medication that needs to be adjusted? Are you working with her physician in conjunction with her physician and seeing if we need to change when we are giving her some of the medication, etc.? So something may be going on with your mom. Then you as a care partner, right? When we get frustrated, is your mom sensing that? And so her yelling and screaming and so on, and it's super hard when we haven't slept. I get that. But we have to, people with dementia feel, they're very sensitive to taking on other people's emotions and frustrations. And then the environment, what's going on in the environment, what's going on in the routine. Is she napping during the day? Is she super bored and therefore, is sleeping more during the day and therefore can't sleep at night? So I would recommend that you diarize, right? Be a dementia detective. I say this all the time. Be a dementia detective. Write down things on the good days. What's the routine? Very detailed. As much detail you can give, the better it is, because then you have a way to kind of look and see what's the good day look like, what's the routine on the good day. And then you have to diarize on the bad day. What's the bad day look like? What's going on in the bad day, right? So we want to make sure that we are constantly looking at those three things: the care partner, the person with dementia, and the environment, and try to figure out how to get all of these things together. And then sleep hygiene. Sleep hygiene is so super important. You want to consider making sure that televisions or cell phones or any electronic is taken away about 90 minutes before bed, because the blue light can actually so blue light actually suppresses our own natural body's melatonin. We produce melatonin, but the blue light from a computer or a cell phone will actually decrease our own body's production of melatonin. It takes about 90 minutes for us to get ready to go to sleep. I would have a very strict sleep routine. Same thing every day, same time. You go to bed at the same time every day. You get up. More importantly, even if you've had a bad night's sleep, the tendency, what we do is, because people need sleep, right, is that we then let them sleep until 12 o'clock the next day. And then that night we can't go to sleep, and then everybody's circadian rhythm, it gets out of whack. Getting up at the same time of day is so important for people with dementia. keeping them in a very structured routine is so important for people with dementia. So you have to get up at the same time. Even if you've had a bad night's sleep, you've got to get them up. You've got to get up yourself. It's better to be tired and cranky that day, maybe a little bit, moderated. But by getting up 8 o'clock in the morning and then making sure that the person gets sunlight, it resets the brain to say this is day and not night. Open the blinds. This is my pet peeve. I go to people's houses and every single blind is pulled down. It's dark as all get out in the house. You want to make it light. They know that it's daytime. You have to make them walk. You need to exercise. You need to keep them active and not let them nap throughout the day. Napping is terrible for adults. And it's terrible for people with dementia. We don't want people to nap during the day. And then there are some natural supplements that you could try, but I would recommend that you look for somebody who's a little bit more educated with that. I know that magnesium can help. One of the strategies is what they call a banana tea, where you cut off the ends of the banana, cut the banana in half, steep that in hot water, boil it for 3 to 5 minutes. It pulls out the nutrients out of the skin, and make a banana tea out of the water, put a little bit of honey in, etc., and that may help somebody sleep. But really, honestly, sleep routine and sleep hygiene is so important to people with dementia. And the more we, and ourselves, my husband has trouble sleeping, so we have a very strict sleep routine. And if we deviate off of it, he doesn't sleep, and because he doesn't sleep, I don't sleep. So I certainly feel your pain. And I think that there is time for one more. All right, I'm going to go with this one. Is anyone else struggling with anger, disappointment, and distancing yourself from family due to no help from them with your loved one? I don't understand how family can do this. Not only to the loved one, but also to you as the care partner. This is such a hard situation. It happens so often, and I am extremely blessed. My sister is extremely supportive. She lives up in New Hampshire. I live about an hour away from my parents, who I support with both of them have cognitive impairment, and so I know how hard this can be. I've seen it happen as an occupational therapist working with people. I know how difficult this can be. But there's a thing called a caregiver readiness to change, right? And some caregivers, and I'm going to grab my little cheat sheet because I can never remember all of it. Alrighty, so what does that mean? And when you know that this is a thing, it kind of makes it easier for you to understand what's going on. It doesn't make it easier. It doesn't make it right, but it certainly makes it a little bit more understandable. And the one thing is, there are four levels to this. The first one is pre-contemplation, right? So this is called the caregiver readiness to change, right? Pre-contemplation. What does this mean, right? Everything's fine. This person's just old. They've always been like this. They're being manipulative. They're just not listening to me, or I don't want to be a caregiver, right? And so when a person's at a pre-contemplation, what do you do about that, right? You have to teach them about what's going on. You've got to teach them about dementia. You've got to ask, how can I help you? What do you want to learn more about, and what would make things better, right? So if you're the primary care partner to someone, and your family's at a pre-contemplation level, they don't understand because they don't see it. They don't live with them, so they don't necessarily see it. The second level is the contemplation phase, right? What is that? We know something's wrong. We're trying to figure out what's going on. We are thinking about changing, but we might not quite be ready to change yet. We lack knowledge about the disease, as it's progressive or degenerative, and we sometimes believe the person is able to do more than what they actually can. This is called contemplation. This person is unsure. This care partner is unsure. And so a lot of times the people who are living with somebody with dementia will be at a contemplation. They figured out something's wrong. They know something's wrong. But they aren't quite necessarily ready to start to take action, but they're getting there. And so we want to make sure that we try to help them at that phase. And we want to try to give, like I would give them strategies and things to do. Then the third level of the caregiver readiness to change is preparation. So these are the care providers or care partners who have figured out that they know something's wrong. They intend to change. They want to change. They're willing to listen. They ask questions about the disease process and how to manage it day to day, and tries to use the strategies in what they're doing. So a lot of times people who have somebody living with them that have dementia, when I go in to work with them, they're between a caregiver readiness to change 2 and a 3. They have a mixture of these behaviors, right? And then the fourth stage is a person who is highly engaged or active, actively participating. They modify, they do the things I tell them to do. They change the environment, the strategies. They try their own things. They practice different strategies. They commit their time and energy to changing this. And they can generalize strategies from one thing to another to another. So the last question was, the person's struggling with anger, disappointment, and is distancing themselves from their family because they're not helping them. So when you go back to looking at the caregiver readiness to change form, lots of times what happens is the care partner for, obviously this person has more of a daily interaction with this person with dementia, and their siblings or family doesn't, and they may not see what she is seeing. And yes, it's hard. It makes you angry. The only thing you can do is educate them. And some other strategies you could try is to invite them into groups like this, or you can invite them to my group called Think Different Dementia Education Group, which I do an hour-long program once a week as well, just on an educational topic. So I would love for you guys to join me. I see I've gone a little over time, but this was the Baffled Brain, Demystifying Dementia, and today was July the 31st. It's almost August. My name is Lizette Klute. I am an occupational therapist, and I truly would invite you guys to join my group. Thank you so much for joining me today. My group's name again is called Think Different Dementia Education Group, and as I end all of my programs every week, the Lord bless you and keep you. I want you guys to know I pray for you guys in this group very frequently. I can't say every day because I don't always do that, but frequently, and that I am here for you. We have a lot in common, and I would love to be able to continue to serve you in my group. So please join, and thank you for being here today, and I will see you guys again next week. And thanks for joining. Bye.